Okay. All right. So I'm going to do this the best I can because I don't have anyone here to record for me. So I'm going to be maneuvering the camera a little bit. But the first thing, this is Michelle Walker doing the IV maintenance check off. The first thing we're going to do is go over the 12 steps because we are using equipment here. So the 12 steps is you're going to verify the care order of the client. You're going to perform good hand hygiene before and after uh, patient care, client care, or handling supplies. And then thirdly, you're going to verify facility procedures and policies and assemble necessary equipment and supplies needed. Fourthly, you're going to consult manufacturer recommendations if equipment is involved, which it is today. Fifth, you're going to knock on the client's door. Six is identify the client with 2 identifiers. 7 is take an overall assessment of the client. 8 is explain the procedure to the client and provide privacy. 9 would be raise the bed for good body mechanics, and then 10 would don PPE if it's indicated. 11 is to, upon completion of the procedure, you want to lower the bed for and raise the handrails if indicated on the care plan, and then also place the call light within reach of the client. Lastly, step 12 would be report any abnormal findings immediately to the charge nurse. And then since we are using medications, fluids, we are, the 6 rights apply to this, which are the right patient, the right medication, the right route, the right time, right patient, right medication, right route, right drug, right situation, right time. I think I got them all. And then, so the first part is I verified the orders. I identified the patient with 2 identifiers. I explained the procedure already to Mr. Bear. As you can see, he's set up here. He's got his IV in his, we're using the right medial cubital vein on the right arm. But first, so his orders are 60 drops per minute. So I'm going to go ahead with my second hand watch, and we're going to try to get that going here. Okay, so I'm going to release the clamp here, get my roller and my bowl. Hopefully it doesn't get all over the bed. All right, and that's too fast. It's really fast. Why is it so fast? There we go. Okay. Good. All right. I count for 15 seconds, so this is, I'm not there quite yet to show you the drops, but I'm just playing with it a little bit. Need to go a little faster. Might be too fast. think I'm about there. Let me double check. Okay. Hold this here and we're going to go ahead and count. And we're going to start right now. "51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61. So 62 drops in that full minute there. Okay. All right. So now, put my clamp on. And we're going to go over here. And I'm first going to assess my patient. So I'm first going to assess my patient with for any complicated responses, any local complications or systemic. When we are assessing before we discontinue an IV, we are going to be looking at the site of the IV, looking for any redness, any coolness to the touch, any hotness to the touch. For this, it's a non-sterile procedure, so we are going to go ahead and put just regular non-sterile gloves on. Okay, and some local complications that you would be warning signs here are any signs of a hematoma, which is blood leakage into the tissue when you're removing an IV. You have infiltration, which is coolness to the touch. It's noted with some swelling, and it can be blanched on the skin there. You want to look for patency of the tube, making sure there's no kinks in the tubing, making sure patency is basically looking for the good flow. Has it stopped flow? Is it's got a continuous flow? And he's got a continuous flow here, so that he's got good patency of the IV. And then, so furthermore with local complications would be, we did infiltration, and then you've got extravasation. I don't think I said that right, but extravasation, which is caused by vesicant drugs, and it can, if such as chemotherapy, can cause blistering. Infiltration is non-vesicant drugs. But the treatment intervention for both would be about the same. You would want to discontinue the IV fluids, remove the IV from the site, put a warm compress on it, and elevate the limb. You can start another IV in the alternate limb. Hematoma would be caused from not putting adequate pressure on the vein upon removal of the IV. For that, you would just, to prevent that, you would put good pressure on it for 2 to 3 minutes, or if they're on anticoagulants, it would be 5 to 10 minutes of pressure. And you can always use a cold compress on a hematoma to try to, clear up that blood that was lost into the tissue. And then you have, of course, a local infection, which would be redness around the IV site. You would have some exudate, some drainage. You would want to culture that. Of course, you would want to, stop IV flows, notify the doctor for further treatment for that wound care. And then you can start IV on alternate arm extremity. And then to remove the IV here. Oh, and you also have phlebitis. I forgot about that. And phlebitis would be kind of a red prominent vein. It can be palpable cord, but it would have a streak following the vein, a redness at the site, and warm to the touch. And for that, you would also want to discontinue the fluids and start on the other extremity if needed, and then also notify the doctor. All right. And put a compress on it as well. So to remove, let me see if you can see this. Okay, so you've got Tegaderm on here to hold the IV in place. And I only had one, so I didn't take it fully off here, but you can kind of see, so you've got the catheter in there, and you've got the tubing, and we already checked for patency here. So to remove it, you want to make sure that the catheter stays in place. So you're going to gently peel towards the IV site from all corners. Okay, and you can tape it to itself so it adheres. And so you're not wiggling that catheter or needle around. And then you want to peel that all the way off. And I'm going to set this, hopefully you can see. Okay, there we go. All right. So you've peeled that all away, and you're just left with your catheter. Okay. All right. And then you want to hold the catheter in place. Make sure that you're not moving it upward or down. Pull it straight out to avoid any risk of hematoma or any abnormalities here, complications on removing it. Taking your 2x2 and placing it just above the IV site. Okay, not putting pressure on it yet until the whole catheter device is removed. And you just want to pull straight out and look at the catheter and make sure it's intact. There's no shearing. Putting pressure on immediately onto the IV site, making sure that no bacteria gets in there. 2 to 3 minutes, like I said before. If the patient is on anticoagulants, you want to make sure that the pressure stays on for about 5 to 10 minutes to prevent the bleeding. And then you want to dispose of the catheter in the sharps container. Before you remove the IV here, I'm just going to put some tape over it. You want to make sure that you have shut off the IV fluids. I had done that prior. I'm sorry I didn't show you that part, but upon coming over here, I'd shut the clamp, stop the fluid flow, and then move forward with removing the IV. Okay, so the tape's on there, pressure's on there, 2 to 3 minutes. And the catheter's in the sharps container. You want to come back in 10 minutes to assess the patient, making sure that they don't have any complications. Look at the IV site again, make sure you're always aware of any systemic complications such as sepsis, which is bacteria in the blood. You can have air embolism, catheter embolism, which is from the shearing, which we made sure we didn't do that today. You know, you never want to reinsert a catheter needle that would cause the shearing. And let's see, I think that is everything. You want to note your, you want to document the site, you want to document the gauge of the needle, the length of it. You want to document the patient's response, how they tolerated the procedure, the time, the fluids that were used. Never want to have a bag go all the way empty because that's how you can prevent the air embolism. And make sure that you put all that documentation down for the oncoming nurse. And I think that is everything. Thank you.